If you do the cannula technique in temples, you'll be relieved to find that in most cases, if you get brow heaviness, it's actually quite common and it is temporary, and it's simply an effect of the lidocaine. So in the space between the deep and the superficial fascia where the nerve resides is exactly where the lidocaine is spreading out and affecting the nerve. And this actually happens in a large proportion of treatments. So it is quite common, unless you tell your patient, for them to suddenly spot their eyebrows aren't moving as much. And this causes a lot of concern and anxiety if you haven't warned your patient. Now, the good news is most of the time, this will simply wear off in a matter of hours. In some cases, it can be as long as 8 hours after the procedure before this fully wears off. But in other cases, like this case I recently came across, something else has happened to cause a much longer effect. So in most cases, this is temporary because the lidocaine eventually wears off. All that lidocaine does is block the sodium channels on the nerves, which means the impulse simply doesn't get through. As soon as the lidocaine disperses, you get activity back in the muscle.